Nursing is a profession deeply rooted in compassion, respect, and integrity. Nurses are on the front lines of healthcare, providing direct patient care with empathy and understanding. They often encounter ethically and legally complex situations. Understanding these aspects is crucial for nurses to provide safe and ethical care. Ethical principles guide nurses in making morally sound decisions. They provide a framework for navigating challenging situations. Legal guidelines ensure that nurses practice within the boundaries of the law. These protect both the patient and the nurse. The intersection of ethics and law in nursing is complex. It requires careful consideration of multiple viewpoints. This essay explores the core ethical principles and legal issues in nursing. We aim to provide a comprehensive guide for navigating this intricate landscape. Ultimately, prioritizing ethical and legal considerations ensures the delivery of high-quality, patient-centered care. This essay strives to equip nurses with the knowledge and tools to navigate this ever-evolving terrain. 4 core ethical principles underpin nursing practice: autonomy, beneficence, non-maleficence, and justice. These principles provide a moral compass for nurses. They guide decision-making in challenging situations. Autonomy recognizes the patient's right to make their own healthcare decisions. Nurses must respect these decisions, even if they disagree. This includes respecting a patient's refusal of treatment. Providing all necessary information empowers patients to make informed choices. Beneficence emphasizes the nurse's duty to act in the best interests of the patient. This involves promoting patient well-being and providing compassionate care. It also means advocating for patients' needs and preferences. Non-maleficence centers on the principle of do no harm. Nurses must strive to avoid causing harm to patients. This includes both physical and emotional harm. It also encompasses minimizing risks and preventing errors in care. Justice emphasizes fairness and equity in healthcare. Nurses should treat all patients fairly, regardless of background or circumstances. This includes advocating for equitable access to care for all individuals. Alongside ethical principles, legal guidelines are essential for nurses. Understanding these legal aspects is crucial for safe and responsible practice. Key legal issues include informed consent, confidentiality, HIPAA, negligence, malpractice, and licensure. Informed consent requires that patients fully understand their treatment options before agreeing to them. Nurses play a vital role in ensuring informed consent. They may witness consent forms and answer patient questions. Confidentiality, protected under the Health Insurance Portability and Accountability Act, HIPAA, is paramount. Nurses must safeguard patient privacy by protecting their health information. Sharing patient information is only permissible with authorized individuals involved in their care. Negligence occurs when a nurse's actions fall below the accepted standard of care. This can include errors in medication administration or failure to monitor a patient's condition. Malpractice is a more serious offense. It involves professional misconduct or unreasonable lack of skill. This can include actions like performing procedures beyond one's scope of practice. Nursing licensure is a legal requirement for practicing nurses. It ensures that nurses meet specific educational and competency standards. Maintaining an active license is essential for legal practice. Ethical and legal issues often intersect in real-world scenarios, creating complex dilemmas for nurses. Consider the case of a patient with a terminal illness who refuses life-sustaining treatment. This situation raises ethical questions about patient autonomy and the nurse's duty to preserve life. Legally, the patient's right to refuse treatment is typically protected. Another scenario involves a patient with a highly contagious disease who refuses isolation precautions. This situation presents ethical concerns related to patient autonomy versus the duty to protect public health. Legally, Healthcare providers may have an obligation to take measures to prevent the spread of contagious diseases. These scenarios highlight the complexities of ethical and legal decision-making in nursing. They underscore the need for nurses to be well-versed in both domains. Section 5. Guiding Lights. Best practices for ethical and legal dilemmas. Navigating ethical and legal challenges requires careful consideration and a commitment to ethical practice. Here are some best practices for nurses. Remain updated on ethical guidelines and legal regulations relevant to your practice area. Attend workshops and conferences to stay abreast of current issues. Seek guidance from your institution's ethics committee when facing complex ethical dilemmas. These committees provide a structured approach to ethical decision-making. Engage in open and honest communication with patients, families, and colleagues. This fosters trust and facilitates ethical decision-making. Section 6. The duty to stay informed. Continuing education and resources. The field of healthcare is constantly evolving. New ethical dilemmas and legal challenges emerge regularly. Therefore, nurses have a professional and ethical duty to stay informed. Continuing education is not just a requirement for license renewal, it is an ethical imperative. Nurses should seek out opportunities to expand their knowledge of ethics and law. Professional organizations like the American Nurses Association provide valuable resources. They offer webinars, publications, and position statements on current ethical and legal issues. Section 7. Seeking counsel. The role of ethics committees. When confronted with particularly complex ethical dilemmas, nurses should not hesitate to seek guidance. Most healthcare institutions have ethics committees. These multidisciplinary teams provide support and guidance in navigating difficult situations. Ethics committees offer a safe space to discuss ethical concerns. They can help nurses weigh different perspectives and consider potential consequences of their actions. Consulting with an ethics committee does not absolve nurses of their responsibility to make ethical decisions. However, it provides valuable support and expertise during challenging situations. Section 8. Open communication. The cornerstone of ethical care. Effective communication is at the heart of ethical nursing practice. Open and honest communication with patients, families, and colleagues is crucial. Patients feel respected and valued when they are actively involved in their care decisions. Nurses should communicate with empathy and compassion, especially when delivering difficult news. Open dialogue with colleagues fosters a culture of ethical practice. Discussing ethical concerns with other healthcare professionals can provide valuable insights and support. Section 9. Conclusion. Upholding the highest standards of patient care. Ethics and law are integral to the nursing profession. They provide a framework for ethical decision-making, legal accountability, and safe patient care. By adhering to these principles, nurses uphold the highest standards of their profession. Nurses are entrusted with the well-being of their patients. By staying informed, seeking guidance when needed, and communicating openly, they can navigate the complex intersection of ethics and law. This ensures the delivery of compassionate, ethical, and legally sound care to every patient, every time.